executive order on AI from President Biden, and with the Senate holding multiple hearings on AI in the last few months, this committee is addressing an extremely timely and relevant policy issue. As a doctor, I am acutely aware of how AI can both spur innovation as well as pose serious risks, especially when it comes to healthcare. We should be encouraging developers to build AI technologies to supplement the work that we do as healthcare professionals. And at the same time, we must be sure to implement guardrails to protect patient data and to be sure that no harm is done in the process of implementing new technology, whether that is through disease diagnosis, clinical documentation, or medical research. We must ensure that AI is used ethically and transparently. Ms. Lang, in your written testimony, which touches on legislative and policy ideas for AI, ITI asks that Congress will follow a risk-based approach and examine existing laws, policies, and sector-specific risk frameworks before considering comprehensive legislation. As you might know, healthcare falls under these categories as it is regulated as an industry. Can you elaborate on these points and how the risk-based approach applies to the healthcare sector?
Sure, thank you for the question. Yes, so in thinking through a risk-based approach, it is very important to, as you outlined, there are several different use cases within the healthcare sector, and certainly something where AI was being used to perhaps perform a surgery that could impact somebody's life or safety. That's likely something that would be designated as high risk and subject to additional oversight and obligations to ensure that that AI is being deployed in a trustworthy and safe way. There might be other lower risk use cases as well in the healthcare sector. Maybe AI is helping to process billing statements in some way. And so there perhaps are different obligations or perhaps no obligations that are appropriate in that setting. So when we think about, what makes sense in the healthcare sector, it's really important to think through what some of the different use cases are that one would be seeking to capture underneath.
I think there are many obligations that definitely occur. And when exploring AI, data protection and user privacy is tantamount. This will be especially pertinent as we begin to use AI in the healthcare setting, where HIPAA plays a large role in keeping our most sensitive data safe. Mr. Rubin, how can we ensure that patient data used by AI is kept secure and safe from cyber attacks?
Thank you for the question. Cybersecurity generally in healthcare is a huge topic and of paramount importance because healthcare organizations maintain, as you said, incredibly sensitive information about patient care, about our health. And so broadly, we have a duty to protect that information. And really, it's about an all-encompassing cybersecurity program that includes technology, it includes the governance, it includes the processes that we employ to protect that information. And AI can be a part of that from a cybersecurity perspective, helping the responders and the defenders better prevent, detect, and respond to any intrusions into a healthcare network.
Do you see in the future that AI will be one of the arms of cybersecurity?
Absolutely, Congressman. In fact, in many ways, it already is. Palo Alto Networks has been using AI in our products for over 10 years, and we're continuing to innovate and make it more and more a common part of how we enable cyber defenders to protect organizations.
Thank you to all the witnesses for being present here today. And Mr. Chair, I yield the remainder of my time.
Thank you. The gentleman yields.